Good afternoon, everybody. Can everybody hear me?
I can hear you.
All right. So thank you for participating in our first School of Health Sciences at International Medical University, our first live discussion during the MCO or pandemic. We're hoping to keep everybody involved and not just stare at home in front of YouTube. So let's make it worth your while. So today we have Prof Anthony Rhodes, a professor in the Division of Applied Biomedical Sciences and Biotechnology at IMU. And by the way, my name is B.Y. Chin. I'm the Associate Dean of Health Sciences. And before we start, we have two housekeeping rules. First is we have muted the microphone for all of you. For questions and feedback, please use the chat box. And when Prof Rhodes is done with his presentation, we will unmute the microphones. Okay? Yeah, Prof Rhodes, go ahead. Hello? I think there's a technical glitch. Yes, thank you. You can hear us. Well, we're trying to get the presentation to come on.
Do I need to share again, Prof. BY?
Yes, yes. Can you please share your screen again?
Sure.
There was a little glitch.
Okay.
All right, go ahead.
Okay, shall we start?
Yes, go ahead, go ahead. Yep.
Okay, good afternoon, everybody. Welcome to today's session. It's all about biomedical sciences and why we think pursuing a degree in biomedical sciences is a good step towards a fascinating and rewarding career. In order to illustrate this, I've highlighted some of the aspects of my career, and I'm just going to go through those different steps in my career so that you get an illustration as what is possible after you finish your degree at IMU. So firstly, I did my undergraduate studies at the University of Luton. I graduated in 1984, and then I wrote lots of letters to lots of different places, and I think two institutions replied to me, of which one was the London School of Hygiene and Tropical Medicine. I went along for what I thought was an interview, turned out to be more like a chat. We seemed to like each other, and I started work at this London institution. First year, I was trained in the laboratory of all the basic techniques in cellular pathology. And then after 1 year, I was registered with the Health and Professions Council. And this allowed me to operate safely by myself in the laboratory and indeed go and work in other institutions if I so wished. What I did after 1 year was to sit the Institute of Biomedical Sciences special examination in cellular pathology, and after 2 years obtained a fellowship of the Institute of Biomedical Sciences, and this allowed me to go for senior posts at other institutions. To then get more experience, apart from tropical medicine, I went to the Department of Histopathology at St. Thomas's Hospital. This is out of interest. This is the same hospital which recently treated our Prime Minister for COVID-19. So I was there 2 years, much larger department, exposed to a wider range of techniques, and this equipped me to apply for my first senior post, which was at Hammersmith Hospital in West London. Not the most scenic part of London. It's sited between the White City housing estate and Wormwood Scrubs prison, where there's maximum security prisoners. But it's a fascinating place to work all the same. It has world-leading academics, medics, and scientists doing some groundbreaking research. And I worked there for 3 years in the clinical histopathology laboratory. And during that time, I did a master's degree in medical molecular biology. And then after 3 years, I decided to make a move and go for my next career move, which was as a chief biomedical scientist at University College London. I was there for 11 years. And during this time, I did my PhD in an area with respect to breast cancer, looking at hormone receptors in breast cancer. And this was probably the first time I felt that I excelled at my studies. I'd always been a very average student up to this point. But the training I got as an undergraduate gave me the background and scientific, logical way of thinking, which was very important when it came to formulate my own ideas into a research project. So I completed my PhD part-time in 3 years. We produced 5 nice papers out of it. And then I decided to make a move again, this time into academia as a lecturer in Bristol. And I gradually, over the next few years, worked my way up from senior lecturer to reader, and then finally professor of biomedical research at Bristol. In 2014, we were collaborating with the University of Malaya, Professor Cheng Ha Yip, in the breast cancer research that we were doing at the time, and I took a sabbatical. So this was 2013. I then went over to the University of Malaya for 1 year initially, and liked Malaysia so much that I decided to stay on and move to Malaysia, and then had a contract in the Department of Pathology at University of Malaya for the next 3 years. So here I was back in the clinical environment, doing the usual academic requirements of a professor in the university, but also helping in the routine clinical laboratory. And I coordinated the quality assurance for the department and helped troubleshoot when there's problems in the laboratory. So after University of Malaya, I'm still an honorary professor there, but then I moved to Taylor's University. They were looking for up to 100 academic staff as part of their strategic research initiative. I stayed there for 2 years, helping them increase their research profile. And at the end of that contract, which is the end of 2019, I was looking for my next position and recently started at IMU in March of this year. So you might ask the question, why choose a career in biomedical sciences? Well, I'll give you an idea as to why I chose a career in this area. It was during my undergraduate years that I was exposed to different areas of science, and in particular cellular pathology, histology and cytology. And I found this a fascinating area of science. Allowed me to look down the microscope, discover a whole new world I never knew existed before. And it was also very hands-on science. With histology, you have to cut sections. It requires quite a bit of dexterity and skill. A lot of the histologists are good DIY enthusiasts as well. They probably knock you up a table or repair the door in your house. So it's that kind of skill set which attracted me to this area of science, this area of biomedical science. And I had a desire to know and learn more, and if possible, to work in this area. I liked the career structure. It obviously gave you career opportunities to progress, both professionally and academically. And indeed, all the studies that I've done, apart from my undergraduate, were done part-time whilst I was working. After 3 years of doing a degree course, rather intense, I enjoyed the new camaraderie you had working in laboratory. It was a big team effort. You're part of a big family, tend to go to tea together, go and have lunch together, celebrate together. People had a baby or getting married. I used to share stories and keep each other amused. So it was never really felt like work, and you're all working to a common goal to get the work out at the end of the day and complete the job. At the time when I joined the Biomedical Sciences, I also had a young family. It's provided job security, and also trained me to work at any other hospital in the UK, any town or city. It gave me that freedom. So my last slide I'd like to talk to you is how biomedical sciences plays a role in the current COVID-19 pandemic. Firstly, you've got to appreciate who does all the tests in a hospital or clinic, who provides the pathology services. When you talk about pathology, people tend to think of pathologists cutting up bodies, post-mortems and autopsies, but pathology is a lot more than that. It provides all the testing that is required in a busy hospital. So if somebody has a road traffic accident or requires major surgery and replacement blood, we're the ones, the biomedical scientists, who need to type the blood, find out which blood group you are, to make sure that the blood that we give you is the same as what you have running in your body, around your body. Similarly, if somebody has a bacterial or a viral infection like COVID-19, you need to determine it is COVID-19 and not a cold or a flu. So you need to test and identify the disease process. I always think it's a bit like Sherlock Holmes. For those of you who've ever read Sherlock Holmes, you should read the book, much better than the films, I assure you. Sherlock Holmes is the one who does all the scratching his head and coming up with the answers, and then he hands the solution on to Inspector Lestrade of Scotland Yard, the police force, and the police are then able to go and arrest the right villain in this case. So in this case, Sherlock Holmes is the biomedical scientist working in the laboratory. We wouldn't know about it if it wasn't for Dr. Watson, who tells us what a great guy this Sherlock Holmes is. And the police are the doctors at the front line taking this information and using this. In this case, this analogy, the villain is the disease rather than the one committing the crime. So it's the same with the biomedical scientists in the lab. They're doing this investigative work, looking at, for example, if somebody has a lump, is this a malignant tumor or is it just a benign tumor? So that requires tissue. You need to look at it down the microscope. You need to identify malignant cells if it is a cancer. You also need to determine what kind of cancer it is in order to give the information to the doctor and allow them to effectively treat the patient. And also other diseases, some of the very common diseases. We need to make that diagnosis of diabetes or heart disease. And this is done in the pathology services of a hospital. So basically, it's the biomedical scientists in these laboratories that are doing the tests and providing the results to the clinicians so that they can effectively treat the patients. And this is also the case for COVID-19 testing. We also have input on government thinking. Recently in the UK, the health minister came up with the fact that we should be providing up to and doing at least 100,000 COVID-19 tests a day. This is all very well, but the head of our Institute of Biomedical Sciences, the president of the Institute of Biomedical Sciences, the professional governing body, had to go on TV and newspapers and point out to the ministers that we have the workforce, we have the biomedical scientists trained and accredited to perform this testing, but there's a global shortage of COVID-19 testing kits. And unless you can provide us with the necessary number of testing kits and the consumables, then we're not able to do this volume of testing every day. So sometimes we can raise our heads and also advise on government strategies at a national level. So hope that has given you a flavor of what biomedical sciences is about. And in a week's time, we'll, Prof BY will be looking at biotechnology and how these devices are constructed, but I won't go into that. I'll let Prof BY talk to you about that in a week's time. What we'd like now is to open the floor to any questions you have and give you more feedback and answer all the questions that you have for us on biomedical sciences. So Prof BY, if you can feed me the questions from the chat line, if we have any, and I'll do my best to answer them.
Hi, Prof. Tony. Actually, there are no questions. So come on, participants. Here you go. There's a question from Shu Shim. Her question is, what are the challenges of being a biomedical scientist?
What are the challenges? The challenges are to become fully trained. I've never seen it as a challenge. There's lots of opportunities. Throughout your career, throughout your life, you'll come and have opportunities. COVID-19 is a challenge, but it also provides opportunities. Provides opportunities for the biotech companies to provide better and improved kits. Challenges, I've never found it a great challenge. I never felt stressed over the work that I was expected to do. Always enjoyed the work I've expected to do. Usually have a very good team atmosphere working in a laboratory. And if there are challenges, you overcome them. Okay, so one challenge was we had a sick lady. This was Hammersmith Hospital. I was working with a pathologist. He didn't know whether this lady who was in ICU had an infection, and if this is what was causing her serious illness. And he thought it might be cytomegalovirus. We didn't have a cytomegalovirus test up and running in the lab at that point, but as part of my master's project, I had a new DNA testing kit or procedure. And he asked me if I'd come in over the weekend, so this is a challenge, and get it up and running and test this lady's samples. And this I did, and we were able to meet that challenge and able to show that the lady didn't have a CMV infection, and they were able to effectively manage the patient more efficiently than if we hadn't been able to provide that test. So there's that kind of challenge, but that's a challenge, but it's more of a inspirational challenge, more of a, yeah, I can do that, we can go out and do it. It's like football team, it's like Man City or Man U.
Okay, let's not get into
challenge
it.
Challenge to win the game, but not necessarily, you don't feel too stressed about it.
True. Well, I like to add to Sushim's question. Sushim, by the way, is an excellent question. How do you prioritize cases? Because as a biomedical scientist, I'm sure you have a huge backlog of cases waiting, and not to say cases, but samples that you have to run. So is that a challenge to you at times? Because who do you put first?
Obviously, the sicker the patient, the more urgent. So that is the priority with respect to testing in a pathology environment. So the sicker the patient. So the pathologist, in my case, who worked in histopathology, he would or she would come and tell you if this is very urgent, and you make sure that that was done in the same day and you get the results out to them as quickly as possible. So that is how you prioritize it. It's how sick the patient is.
Okay, let's bring that context to the real world current situation. This was a point that was brought up back in your home country where Boris Johnson was first diagnosed, and they said that they did not prioritize him. So so in some ways,
who said this? Who said this?
This was in like the newspapers, like Daily Telegraph, Skynet News, and stuff like that.
Oh,
so
okay.
in some cases, is it in pandemic situations, do they treat everybody the same? So that's the question.
I think it's always the case, regardless of which area of health professions you work in, that you treat the most urgent and the most sick case, acutely sick case first, and that's your priority. Obviously, if there's lots of urgent cases, then you have to work twice as hard and maybe more quickly than you would if there's only one sick patient. So I've never seen any healthcare worker in the NHS this is the priority of any hospital worker, is to treat those which are the most sickest first.
Okay.
So even Boris Johnson, if he was sick.
Yeah, because if he's really, really sick, of course, they'll have to treat him first. So you're absolutely right. Scientists, what scientists do is we handle the worst case scenario first.
That's true. Yeah.
The extent of it. Yep. Okay. There's another question from Hannah Sadida.
Hi, Hannah. Hi.
Are scientists, like biomedical scientists, when they do testing, they required to wear full PPE gear?
It depends. If you work in infectious diseases in microbiology, then yeah, you would. If you work in an area like histology, where everything tends to get fixed in formalin and everything's pretty dead and inert because of the, then no, you wouldn't. You don't need to wear. You wear a laboratory coat. So it depends on the level of infection in which you're working, and of course, if you're dealing with very infectious samples, then you need to do it in a class, appropriate class hood as well to the microorganisms. So you not only wear protective clothing, but you're also doing it in a special and contained environment.
Okay, just to summarize a little bit. So if you're working with, let's say, routine, cutting up sections, you're running routine blood tests. So basically, you just wear gloves and your lab coat and a face shield if required, right? Yeah,
sure. I mean, each discipline will have its guidelines as to how you wear protective clothing. Sometimes, if, for example, you're cutting histology sections and wearing gloves, which I've seen, it's more likely to hinder your dexterity and injure yourself because you're wearing gloves, and it's an unnecessary precaution. But obviously, if you're dealing with infectious microbes, then you need to be wearing gloves and the appropriate protective clothing. So you need to wear the level of protective clothing which is sensible and appropriate for the samples that you're dealing with. If they've all been fixed in formalin, everything is dead already. There isn't any danger of infection, and therefore there is no need to wear even gloves in that scenario if you're dealing with fixed tissue which is in a paraffin block. Obviously, chemicals themselves have, so sometimes you wear protective clothing to protect yourself from the chemicals. So, yeah. And formalin is not a very nice chemical, so you need to wear gloves to protect yourself from the formalin, but not from the actual samples.
Yeah, in case it fixes your skin, that's one thing, right?
Yeah, it's not a nice experience. It's quite painful.
Well, as opposed to, because I'm sure there are a lot of questions that are coming up. when they test for an infectious agent such as blood from a COVID-19 patient, can you share with the students what kind of PPE they would have to wear?
They would, if you're working in a laboratory, the main, you would work under a hood and you would be wearing gloves. With a blood, you wouldn't expect there to be volatiles coming, so you wouldn't necessarily have to wear anything to cover your face. You'd be working under a fume hood anyway, and you'd be wearing gloves. So that's the type of protective clothing you need to wear.
Okay.
Seems to be, yeah. Protective clothing is very much, you take it, it's not a big thing you think about when you're working in the laboratory. You wear it, you wear the appropriate level. So it's, you're aware of health and safety, but you're also aware that you need to get on and do the work, you don't do the job.
Okay, that sounds reasonable.
Okay.
Unless you have to go out and collect samples, that's when you wear your full gear, correct?
Sure. Yeah. I mean, if you're collecting samples from an infected patient, yeah. So most of the biomedical scientists would not be collecting the smears. The frontline workers will be collecting those samples. Biomedical scientists are usually in the laboratory, then they get the samples. So they're not face to face with an infective person in the same way that nurses and doctors are. So the level of protective clothing that they wear may not be the same, have to be of the same stringency as say a nurse or a doctor who's treating the patient, or indeed getting the samples.
Yeah, I think that has to be a very important distinction where, biomedical scientists are not really on the front lines. And the secondary part where the samples are given, collected samples are given, so all the precautions, the major danger, I'm not saying that it's not dangerous, but the major danger has been dealt with the sample collectors.
Yeah. I mean, the healthcare workers usually getting sick from their job, or the nurses and the doctors on the front line. Yeah. Okay,
there's a question by Rangarusu Srijaya. Yeah, hi. I hope I pronounced your name correctly. So the question is, how do you actually test for COVID-19?
At this point, the approved test is do a reverse transcriptase PCR. So you have to isolate the nucleic acids from the sample, and you're looking for the RNA of the virus, and you isolate the RNA and you convert that to DNA, and then you look for the sequence, the unique sequence of the COVID-19 virus. And if you find it, then that is a positive result. And if you don't, then it isn't COVID-19. And that is the most accurate way currently to test for COVID-19. There are other tests, but as far as I'm aware, they still need clinical validation on a large volume of clinical samples at different stages of the disease in order to ensure their accuracy. Otherwise, there is a danger of you getting a false negative result, and the person does actually have the disease and you said they're negative, or a false positive result, in which case the patient undergoes unnecessary and expensive quarantine for the next few weeks. So it's important to have accurate tests being done by qualified personnel and using accredited test kits.
Yep. So that's the nucleic acid portion that's routinely done worldwide right now. They're currently also developing antibody testing.
That's correct, yeah.
Yeah, could you tell the audience a little bit about that?
Yeah, I mean, this basically involves the recognition of antigens. And as far as I'm aware, these kits, they're more rapid. They can be done in the space of an hour or so, unlike the nucleic acid test, which require most of probably at least 24 hours to get a result. They're not as expensive, but as far as I'm aware, they still need more clinical validation to avoid the false negatives and false positives. There is also a need to determine at what stage of the disease that they will recognize COVID-19. They may not pick for example, if you're looking at antibodies, you require the body to produce antibodies. And somebody who has just got a COVID-19 infection may be at the stage where they haven't actually produced antibodies to the virus as yet.
So you would suggest that that would suggest that the nucleic acid or the PCR testing is done first, and the antibody testing should come later on. Because you're looking at two different aspects. One is the DNA, and the other one is actually a protein molecule.
Yeah, the antigen testing may well prove to be just as good and more rapid and not as expensive. The problem is you need to, this goes with any laboratory test, you need to validate it. It requires different steps of validation, and the final step is clinical validation, where you test it out on patients. Yep. And you get the information as to how effective it is. And to do that, you need a large volume of patients, and in this case, at different stages of the disease when you're looking at an antibody system.
So what you've described actually tells us what's currently going on in the world, where there have been false positives and false negatives because they don't have enough of a sample size to
and yeah, and there's a wide range. We recently produced we recently reviewed what was going on in Malaysia and Singapore, and if you look at Singapore, I'm sure many of these tests will prove to be fantastic and just as good as the PCR test. But if you look at Singapore, the amount of tests that have undergone initial accreditation to be allowed to be tested, must be 15, 20 different types of tests. So they can't all have the same level of accuracy. It's unlikely, I would think. So all these tests need to be, some will be, like I say, some will be very good, maybe, or probably just as good as the gold standard PCR test. But you need to do the validation first.
Yep, which is what biomedical scientists have to do in order to generate results, because you actually can determine somebody's livelihood. To be told that you are positive and to be told that you're negative. So it's actually, biomedical scientists play a very, very important role. Do you agree?
Yeah, I mean, you don't want to get a false negative result. Otherwise, the person ends up, if they, for example, if you got a false negative of COVID-19, so they not only will infect other people around them, but they will also eventually get treatment probably later on in the disease process, and therefore may well die because they had a late diagnosis as opposed to an early diagnosis.
Okay, this is a question that has come up more often than not. If my main goal is to become a pharmaceutical scientist, would it make more sense for me to pursue a degree in medicine or biomedical science? This is from Allison.
In pharmaceutical science?
Yes.
in biomedical, the difference between a biomedical science degree and a medical degree is there is a lot more science in a biomedical science degree. So you would be exposed to a lot more of the theoretical understanding. Medical students have to be very clever, and they have to study a wide range of diseases, and therefore the level of scientific understanding, they just don't have the time in their 4 to 6 years and they're studying medicine to go into the depth that a science or a pharmaceutical science or pharmacological science student would have. So if your main aim is to go into that area of science, then yeah, you would be better to go in initially to study in pharmaceutical science and biomedical science or pharmacological degree than you would a medical degree, in my humble opinion.
Yeah, I completely agree with you on that one. Okay, from Brian Law. Can biomedical science graduates get a job in Malaysia?
I should think so. I should hope so.
Clinical related jobs, private or government sectors?
Yeah, I mean, Malaysia has a big healthcare industry, so I don't think you would have any problems getting work in Malaysia. No, I think there's plenty of scope. There are many both government and private hospitals and also private clinics. Some of the private clinics are quite large as well. So no, I don't think you'd have any problems getting employment in Malaysia.
And go back to your early beginnings in the UK. You actually went through working in academic institutions and also clinical institutions. Which to you was the most exciting?
The most exciting.
Fair question, right?
Yeah, difficult. I enjoy both. I mean, if you work in a laboratory, time goes out the window because you're doing a technical piece of work, and therefore when you're doing something with your hands technically, time tends to go very quickly. If you're in, say, doing research, you have to sit and ponder and plan and sit at your computer for long hours, and that time can also go very, very quickly. Both are very rewarding. They've got different challenges and different rewarding experiences. Working in academia is more theoretical, obviously more teaching, classroom style teaching anyway. Whereas working in a laboratory will be far more technical. You'll be doing things more. You won't be, or you shouldn't be, kind of looking at your phone or doing things on. You'll be doing things most of the time. Sorry?
Are you telling us we can look at our phones?
Well, no, you shouldn't be looking at your phone either.
Okay, that's fair. This is from Vania Jeremiah. What are certain characteristics needed to become a biomedical scientist?
Passion and enthusiasm for the area of science in which you choose to work. And I think that is good advice, whether you want to be a biomedical scientist or whatever you want to be in life. You need to be working at something you enjoy doing, and do it because you want to do it and not because somebody else wants you to do it. I think that would be the best advice that I could give you with respect to choosing not only whether to work in biomedical sciences, but whatever you choose as a career.
Okay. Along the same lines, if somebody were to get a biomedical science degree, undergraduate degree from IMU, then they would like to work in the UK. And can you walk her through how she would do that?
Sure. Well, the great thing to start with is that the IMU degree is accredited with the UK IBMS. So you're halfway there already, in that you have the theoretical understanding which has been accredited by the UK professional body, the IBMS. You would then need to find an employer in the UK who is prepared to take you on, and you would need to join that institution. They would probably pay you as a laboratory assistant to start with, so you would get paid probably at least a few thousand ringgit a month, maybe more. And your training would be checked to see that it was up to the standard required to work in a UK laboratory. You would be required to compile a portfolio of your technical skills that you'd acquired. You're required to have a logbook and record these and do some reflective learning on what you learned at each of the techniques that you work in the lab. And then, not necessarily after a year, but when the training officer considered you were now safe to operate in the laboratory, you would have a viva by one of the professions from the IBMS. And if you pass that viva, you would then become registered with the Health and Care Professions Council, and you would then be qualified to work anywhere in the UK. It's not as difficult as you might imagine. At the moment in the UK, they're recruiting, as with the doctors and nurses, they need more help in the laboratories, and the health and care profession are compiling a provisional register for third-year students and also retirees who can come back in and be on this and help with the COVID-19 testing or train in that way. So it is a possibility, and the fact that if you studied biomedical sciences and it wasn't UK IBMS accredited, then there would be a question mark about whether you had learned the appropriate theoretical knowledge before you went and did your lab experience and again that accreditation with the Health and Care Professions Council. So it is possible. I mean, IMU, one of the placements for the, I think it's the first placement, is to work in a laboratory. It's also in the final year, it's more of a longer placement, but in the placement in the first year, you are allowed to go overseas, and there's no reason why that couldn't be the UK. If you get to know the right people, it's all a case of knowing somebody. Quite often, as in the case when I've got jobs, it's a case of going knocking on doors and going visiting people and having a lab tour and getting to know the laboratory manager or the head of the laboratory and letting them see how enthusiastic, what a capable person you are. You need somebody to give you a chance, basically. And this is what you need to. And once you get that opportunity, it is a reality.
Yeah, I think the world is your oyster. There, once you get your degree, your biomedical science degree in IMU, because we are internationally benchmarked, you can essentially go anywhere. But before that, you have to take that provisional test in the UK. like to take a moment to inform the participants that I'm collating, I'm integrating a lot of your questions because a lot of you have asked the same questions in a different way. So I think what Prof Anthony is doing is actually answering a lot of the questions that are coming up, because the key questions are, can I work abroad, which you've answered, and I'd like to add to that, in addition to what Prof Anthony has mentioned, is that at IMU, we actually have a 6 months practical training or internship, practicum as they call it, to go anywhere you want in the world. As Prof Anthony was saying, if you want to go to the UK, you can go to the UK as well. And if you want to go to the US, you can as well. It's just a matter of what areas, exactly like what Prof Anthony was mentioning, then when what particular area that you're interested in. For him, it's histopathology and cytology, right, Anthony?
That's correct. Yeah, that's correct. You got it right.
Yeah. Yep. Yeah. And so and for students who are interested, I'm sure when we get offline, you can send inquiries in, and we'll be more than happy. I mean, Prof Anthony will be more than happy to respond to those to your questions. Okay, let's move on. This is a very interesting question. How does an N95 respirator mask protect us from COVID-19?
Well, yes. No, you're going to have to think off the top of my head now. As you probably imagine, I'm not a virologist. I'm not. I haven't worked in microbiology, but I would imagine that it requires many layers of filtration. I would imagine. So you caught me on that one, but
yeah, this is one of the questions that was
from a scientific point of view. I would imagine it requires many layers of very effective filter, all of decreasing size, to actually make sure you prevent any or prevent the COVID-19.
Yeah, I didn't mean to catch you off guard, but this was, of all the questions asked, this was the most unique one, and I think your response was great. And I mean, it's many layers, preventing the actual virus particle itself to be lodged up in your nose. So it's rather that it's on the surface of the mask as opposed to be in your nasal passages. Okay.
Yeah, sure. And if the person who sent the question thinks they have a more valid and better answer, then we're more than happy to listen and be educated by you at the same time.
I don't think he has responded yet, but this is a philosophical question. From the perspective of a biomedical scientist, this is from Angelique. It's actually really interesting. She asked, what do you think should be done to improve the world situation currently? From the perspective of a biomedical scientist.
Right, okay. Well, we wrote an article, well, we just written an article for the UK IBMS. It's not actually a journal, it's a periodical that comes out every month, which all UK biomedical scientists get. And basically we summarize the COVID-19 pandemic in Singapore and Malaysia. And a common denominator which appeared to arise, be a source of these second waves of infection, are the crowding of particularly migrant accommodation, where social distancing and basic hygiene is almost impossible. So that begs the question, as COVID-19 seems to be able to equally affect the Oxford-educated Prime Minister of the UK as it can a child living in the slums of Jakarta, then we all have a vested interest to do something about the poverty and the living conditions of people living in the world today, not just because it's the right thing to do, but because we need to eliminate and address where the next wave of infections is going to come from. And it seems to be a common denominator both in Malaysia and Singapore, that the second wave infections have come from housing areas which are quite old, quite cramped, and not ideal with respect to living conditions. So I'm not sure if that is a type of statement in which you think the biomedical scientists could make with respect to, in this case, COVID-19.
Well, I think it's really, well, you brought up a very, very important point, because remember, almost a century ago, we had the initial flu pandemic.
Okay, yeah, sure.
Right? Where public health and society had to really learn how to not discriminate between classes, meaning it can affect anybody and everybody, as you so pointed out. So, you know, changes in healthcare, changes in interaction, you know, social distancing. They want to rename it physical distancing now. So I'm not sure whether you heard of it in the last few days.
Okay.
You know, instead of socially distancing, it's physical distancing because of the crowded dormitories. I mean, socially, you don't have to live with somebody because you're forced to live with somebody. So it's not really social, it's just physical distancing. So, you know, the fact that changes will come as a direct result of this COVID-19, which you have somewhat alluded to. Dormitories may not allow more than 8 or 10 people anymore.
Yeah, I mean, initially, I'm sure Singapore, I mean, it's obviously segregating migrant workers from the rest of the population is obviously very controversial. But you've also got to give credit to Singapore that these dormitory accommodations were probably initially better than some of the accommodation that the workers might have had at local boarding houses down in the center of the city. So I'm sure Singapore is trying to get it right, and looks like that they are acting on that now and trying to improve those conditions for migrant workers.
Okay. We basically have 10 minutes left, so let's run through the questions. Want to make sure that all the questions are actually answered. This one is a good one. The biomedical degree course, is it more diagnostic based or research skill based?
It's a mixture of both. You do a research project in your final year, but in order for it to be accredited, you need to acquire all the technical skills and the theoretical knowledge behind those technical skills that you would need to work in a laboratory. So it's a mixture of both. It would actually provide you, I mean, I have both a research background and a biomedical science background. So I'm kind of evidence that it can provide for both, really. Of course, you can go straight on from a biomedical science degree and do a PhD, and then go completely into an academic career if you wish. You don't have to go in the laboratory. There's many different avenues different types of career you can go into after getting a biomedical science degree. It doesn't have to be healthcare, and it doesn't have to be research or working in a university. There's quite a range. Pharmaceutical industry, for example, and so on.
Well, you've segued into a very important question that was asked more than once, is do you think working as a sales and marketing executive is a good good value for your biomedical science degree.
It can be. It can be. You're very well qualified. The world needs, commercial big companies need experts. Obviously you need knowledge in business administration, but you also need to understand your customers, and you could become a product specialist, for example, in which your technical skills will be pushed to the limit, because your customer will be calling you out and say, well, why is this not working? Why you sold me this kit or this piece of equipment, and how come it's broken down, and things like that. So your biomedical science training and theoretical understanding will be very applicable to this field also. What I would also advise, if you really, I have a colleague, a friend in London from China. He initially did a medical degree. He then came over he's working at Hammersmith Hospital, did his PhD, and then he did an MBA. And with that combination, and also he could speak Chinese and he could speak English, he's now a very successful businessman, because he's got a scientific background, he's got a medical background, and he's also done his MBA, Masters in Business Administration. So now he's earning lots of money at a big company, I think based in China, but it brings products to the UK. So in a similar way, having a thorough, very scientific knowledge, biomedical science, will put you in very good standing if you want to go into that industry.
Okay. We've gotten quite a few questions on how the biomedical science graduates will be able to use their practical skills. And could you tell them a little bit about the internship of the practicum?
Yeah, sure. So how they could use their practical skills? Well, they would obviously use them in the laboratory. They don't quite understand the question about how they would use the practical skills.
How would they acquire these, sorry? How would they acquire these practical skills that they can go out and then...
You would acquire these practical skills mainly by your placements, and also when you start your first job. Nobody is going to expect you to be an expert when you get your first job after your degree. There's very few degrees, even medical degree, even doctors. They're still very much spear carriers when they start their new job. They're still learning. So you will get most of your training when you start your new job. You'll get some experience when you do your placements. I would see the placements, the most valuable, or one of the valuable things about the placement is networking and getting to know the different places, people getting to like you, and therefore giving you the opportunity for your first job. So I don't think you're expected to be a technical expert when you graduate. You're expected to have a good theoretical knowledge of the science behind some of the techniques that you're going to learn, but you will still be a trainee to start with respect to practicing and harnessing and making those skills so you're an expert.
So basically, just trying to summarize a little bit, what you're trying to tell the participants is you get to learn the fundamentals in the laboratory skills when you do your practicum or your internship, But not only that, you also get to learn how to work in a team together
That's
with
correct.
a group of people,
Good point.
and to be able to communicate, which is very important, because nowadays we just text message each other even though we're sitting next to each other. But when you work on a team, I think verbal communication is so important, right?
I totally agree.
Yeah.
It's very much a team approach, laboratory, and yeah, it enhances your social skills, your ability to be a leader, to be a team member as well. So
yeah,
all these are important skills.
In this kind of practical internship training is once you learn how to communicate, then, as you said, those who actually are able to communicate further or have the passion and drive will then move ahead, like you did when you did your master's and your PhD.
Yeah, I mean, I think these are underrated skills. I think academic brilliance is overrated when it comes to the workforce. Nobody's really after they're after somebody who's a good team player who can do the job. They're not really after somebody who's you can be academically brilliant, but unless you are a team player and can work hard and help the team to achieve the goals that they need to, then this is far more important.
Yeah. Okay. One more question then we will end this discussion. What advice do you have for the students or prospective students of biomedical science out there? What advice do you have for them to decide on their careers?
Okay, so number one, as I did mention earlier, you need to choose a career in which you have a passion and enthusiasm for, because you're going to be doing it for the rest of your life. If you don't, then you're not going to do it for the rest of your life, because you're going to wake up in the morning and think, oh no, I don't want to go into work. So you want for it to be the opposite. You want to wake up in the morning and say, yeah, I'm going to work, and look forward to it and to meeting your colleagues when you do the work. The second piece of advice would be to capitalize on the opportunities which life gives you, and do not expect opportunities to come gift wrapped with a big label on them saying golden opportunity. They don't. They come usually with a bundle of negatives, and sometimes financial negatives. Sometimes if you want to do a master's degree or PhD, and someone will say, well, if you want to do it, you can pay for it. So, or what else? I mean, I can think, I give you the list of all my career steps, and they all look like, oh yeah, golden opportunities, but they were by no means all golden opportunities. They're opportunities, and you need to be able to recognize the positives and to exploit and run with those positives and go around the negatives. So in life, you need to grasp the opportunities, and that is what will give you a successful career. But don't expect those opportunities to become gift wrapped and with a big golden bow, because it won't. Okay. So yeah, that would be my main advice to anybody, basically.
Yeah. Okay, I think our hour is up. For those who have more questions, please continue to put them in the chat box, or please direct your questions onto the website or the link that you signed up for. And Prof. Tony, I'm sure, will be more than happy to respond to them. Okay, so on that note, I'd like to thank all of you for participating. Just to let you guys know that we have the School of Health Sciences at IMU. We have a series of live discussions, Next week will be the nursing discussion and the dietetics with nutrition discussion. And the following week will be the medical biotechnology discussion, where I will be the person who will be speaking. Okay, so thank you so much, Tony.
Thank you.
It was fun, and hopefully, if the demand is there, maybe we'll do it again, part 2.
Yeah, sure. Hope to see everybody in IMU.
Yeah. Okay, thank you.
Bye-bye.
Bye.
Bye-bye.
Okay.